Attention humanitarian and development professionals. Are you looking to take your career to the next level? Then you've come to the right place. Humanitarian Global offers self-paced online courses designed specifically for you. With our comprehensive curriculum, you'll build your capacity in the most critical areas of humanitarian and development work. Our course offerings include monitoring, evaluation, accountability and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant and young child nutrition. With Humanitarian Global, you'll have the opportunity to grow your skills and impact the lives of people in need. Visit our website to learn more about our courses and apply today.
And today's title is WASH Humanitarian Response. We kindly request that you give us just 2 more minutes for other participants to be able to join in. As I see, there's a lot of participants who are joining in. As we wait for other participants to join in, allow me just to share some house rules. So house rule number 1 is in case if you have a question on the topic of the day, kindly do share with us the question on the Q&A section. And after our expert for the day, who is Susan Masila, has presented, she will be able to take up a few questions after her presentation. And kindly do share your questions on the Q&A section. Use the chat section for comments in case if you have a technical issue, we are able to assist you on that. Or in case if you'd like to share your details with us, do share them with us and we'll be able to reach out to you. In case if you're interested in any of the courses that Humanitarian Global does offer, do share with us your contact details and we will be able to reach out to you and mention the course that you're interested in. House rule number 3 is at the very end, as I did mention, Susan will be able to take up some questions and some of the questions she'll take up live. And so if you'd like to ask your question at this time, I will ask participants to raise their hands and I will allow them to unmute themselves and ask the questions on the live webinar. So it's 5 minutes past the hour. I believe we can join. We can start now. We've given enough time for other participants to join. So as I did mention, welcome to this free water sanitation and hygiene webinar hosted by Humanitarian Global. Today's topic is WASH Humanitarian Response. And our key speaker, our WASH expert for the day is Susan Masila. As I did mention, this webinar is hosted by Humanitarian Global, and at Humanitarian Global, we are a big team. At this point, I'll just welcome a few of our team members just to say hello, starting with Ian. Ian, you can say hello to the team.
Hello, everyone, and thank you for joining our session today. We do look forward to an educative session, and for any challenges, please engage us on the chat section, and for any questions, let's direct them to the Q&A. Looking forward to an educative session.
Thank you so much, Ian. And I can already see people are taking up the initiative and being very active on the chat section. They're letting us know where they're joining from. So you can also do that. And even when you do share your contact details, just know you're sharing the contact details with the panelists only. Not anyone can see your contact details. So we do have data privacy where we are protecting your personal details. I'd like to welcome our expert for the day to say hello, Susan Masila, who's with us. I will welcome her back later on. Susan Masila.
Hello, Diana, thank you. Hello to the Humanitarian Global team and to the rest of us joining in from all over. I just want to say hello, and I'm sure we'll have a very interactive session. Pardon me, there's some bit of drilling that won't last very long. Then I'll be able to speak without a lot of interference. Diana?
Thank you so much, Susan. And there is a few other staff members on board. We do have Anthony and Brian, who are not able to speak right now, but on their behalf, they do send their salutations. Before we start, before we get into today's webinar, I'd like to just mention a little bit about who Humanitarian Global is. It's very important that we know who the host of this webinar is. Humanitarian Global is primarily a training institution, and through our training services, we've been able to establish a platform that assists and helps humanitarians, those in the development and aid fields in terms of reaching their career potentials, in terms of achieving their personal goals, as well as achieving just the next steps within their career, be it organizational solutions or individual learning progress. And this has been done through the courses that we do offer. So we do offer courses ranging from certificates to diploma to postgraduate diploma. And this is in various fields in monitoring and evaluation, procurement, nutrition, humanitarian essentials, and so on and so on. So today's webinar touches on water, sanitation, and hygiene. And we do offer our certificates. We do offer diplomas as well as postgraduate diplomas in WASH. We also do have other programs, other short certificates, as you can see on the screen, on that are related to WASH, such as social and behavior change communication and menstrual hygiene management. So on today's topic, humanitarian response in WASH programs, we're going to touch on a little bit on humanitarian essentials. So this is an upcoming course as well on humanitarian essentials and principles. And here you get to understand more on the principles of being a humanitarian, on people management, resource management, budget management, core humanitarian principles as well. You get to understand the relevance of being a humanitarian and the principles that you do follow, the core standards, the working standards that you do follow as a humanitarian. This course is really taken up by those in the humanitarian field, development field, and aid field, as well as those who look to transition into this field. Maybe you want to work for an NGO, or you're already working for an NGO. You're working for an international body such as the UN. This is a really good skill to acquire, because that way you become more marketable within your field. And something else that this webinar is going to be touching on is proposal and report writing. So this one also is a core skill to have as a humanitarian, as someone who works in the development and aid fields as well. So under proposal and report writing, you're going to be understanding the requirements that donors have. You're going to be understanding, formatting, and guiding your proposals. You're going to be looking at how are you funding these proposals? How are you funding these projects? Remember, at the beginning of every project, we always have a proposal that will guide us through the project and program development. So this is the very first step of any project, the very first step of any assignment you undertake in the humanitarian field. Maybe it's in an NGO that you do work in. This is the very first step you take, and this is actually quite important. I would say it's mandatory for humanitarians to be able to know and understand how to write proposals and reports, because even if you do evaluation of projects, at the end of this project, you're required to write a report, and you need to understand how to go about that. So under this short course, you're going to be able to understand that, and you're also going to be looking at best practices when it comes to proposal and report writing. You'll be able to see what other organizations have done, what other people, experts in the same field as you have been able to do. And at the end of this course, you'll be able to effectively write your own proposal. So these courses, the two of them, Humanitarian Essentials and Principles, as well as the proposal report and writing training, are costing $250. And this is because it's going to be a 1 month. You take around 2 classes a week in the evenings during this course of this 1 month, an interaction with the trainer virtually. So it's just being in a classroom. Only difference is it is virtually. You're going to be virtually interacting with the trainer. So it's one-on-one interactions with the trainer. It's not like our other mode of learning where we say it's self-paced online courses, where we give you the reading materials, the videos, and the assignments to do on your own. This one, the trainer does take you through classes. Every week you have about 2 classes, and there's also assignments that you're going to be doing and giving back to the trainer. So I really do encourage you, take up these 2 courses, Humanitarian Essential and Principles, as well as Proposal and Report Writing. It's a 1-month online virtual course. In order for you to register, kindly click on Apply Now or request a callback. As you can see, I was toggling over the screen. Click on Apply Now, you apply, a form will be generated for you to fill, submit the form, and we'll be able to reach out to you with more details. Request a callback in case you need assistance in terms of registering for this course. Alternatively, you can share with us your details if you're interested in undertaking these 2 courses. I'd like to mention that for every class, we take up a maximum of 10 participants. And the reason for this is, as I've mentioned, it's a virtual class. You're interacting one-on-one with a trainer, and therefore we limit the numbers just so that we can be able to move together with the trainer. We can be able to acquire the skills that we've come to acquire. We don't want anyone being left behind. So that is why we take up a maximum of 10 participants, and it's usually on first come, first serve basis. So if you're interested in these 2 courses, kindly do share your details with us. Alternatively, we have shared the links for the 2 courses in the chat. Just click on the link and come and click on Apply Now. At this point, I'd like to now hand over to our expert, Susan, who will be talking about WASH humanitarian response. And throughout her presentation, in case if you have any question, kindly do feel free to reach out to us in the Q&A section with your questions, and we'll be able to answer at the end of Susan's presentation. Susan, the floor is yours.
Thank you very much, Diana, for that introduction. Hello once again. I think there was some bit of noise when I was introducing myself, so I'll do that again. My name, as Diana has mentioned, is Susan Masila, and I'm a WASH expert based in Kenya with over 10 years experience in the Kenyan and Burundian WASH sector. And today I want us to discuss a bit about WASH response in the humanitarian context. So I'll just share my screen. And I'm very impressed with the chat, the ongoing chat, just seeing people from all over, from Ethiopia, from Somalia, Zambia, South Sudan, Nigeria, Malawi. Welcome to everyone. Tanzania, welcome. As I share my screen. So as I mentioned, I want us to discuss a bit on the humanitarian response when it comes to water, sanitation, and hygiene, which is slightly different from interventions that would be applied in the normal, stable context where life is going on as usual. When you're talking about the humanitarian response, we're talking about a situation where the normalcy of our daily lives has been disturbed by something. And we'll look at what these types of disturbances look like. So as a way of introduction, safe drinking water, sanitation, and hygiene are fundamental to improving the standards of living for people all over. It doesn't matter where you come from, whether it is in the rural or in the urban context. WASH is important for our daily lives and for us to be healthy. Improved standards are made possible by WASH, include better physical health, because we have clean and safe water coming into our houses, or we're able to fetch or access this clean and safe water. Protection of the environment, of waterways such as rivers, lakes, oceans, boreholes, groundwater. Better educational outcomes. We observe that especially in learning institutions, in schools, where there is provision of clean and safe water, where there is enough sanitation facilities for these students to access, then they have better educational outcomes, because then they don't need to worry about where they're going to go to relieve themselves. And when they're thirsty, they know that they're drinking water that is good and safe for them. Convenience, when it comes to time saving, especially in the rural and the peri-urban settings, where we have water that is not piped to individual dwellings, so people have to queue for a certain amount of time to access this water, where we have increased access in terms of more taps, more developed water sources, then of course it means that you have less people queuing to access a tap or to access a water source. And then finally, assurance of lives lived with dignity and equal treatment for both men and women, and especially for women and girls and the old, because we find that those groups tend to be vulnerable when it comes to accessing sanitation facilities. So the location of the sanitation facilities is also very, very important to just ensure dignity as well as security or safety to these groups. Poor and vulnerable populations have lower access to improved wash services and have poor associated behaviors, okay? So we basically, what I'm saying is, because they're not able to access clean and safe water, you might find that their need to access the clean and safe water is quite diminished. And so they settle for anything, and they, anytime there's rain, they know, oh, there's going to be some flow through a river nearby, so that now they make sure that they're fetching that water. And most times you find that they won't really fully clean it, and that would cause a lot of health issues. So improved wash is therefore central to reducing poverty, promoting equality, and supporting socioeconomic development, okay? So these are the type of disturbances I was talking about, or emergencies or disasters, but there is a difference, of course, between emergencies and disasters. But the types of emergencies could include tornadoes, snowstorms, hurricanes, sinkholes, floods, tsunamis, earthquakes. For example, the earthquake that really devastated life in Turkey. You can observe that there's been a lot of humanitarian response in the country to mitigate the effects of that earthquake. So these are just some of the emergencies that humanitarian actors would be involved in or would respond to, okay? So where we have displacement of large numbers of people, then there's a likelihood of increased waterborne disease outbreaks, especially where the living standards are not permanent, so to speak. And then there's overcrowding, then there's a likelihood that waterborne disease outbreaks are going to happen, and this needs to be prepared for and plans set to ensure that the minute there's even someone who's coming into a health facility with some symptoms that are similar to what is expected, then we already know how to respond to this. It's quite interesting to note that even during disasters or emergencies, a lot of death is actually associated to issues that maybe are not directly or are directly influenced by the emergency, but not because of that emergency, if you get what I'm saying. So you find that, for example, where we have experienced an earthquake, okay? It means that a lot of people will need to relocate to makeshift shelters, and that means there's going to be a situation where sanitation facilities are not permanent. We are just responding to the earthquake, so we might put up facilities or makeshift structures that allow us to relieve ourselves but are not quite sanitary, okay? It's just to try and control where people go and relieve themselves as we try to stabilize the situation. So causes of death in emergencies, it's quite interesting to see that 54% of death mostly is due to malnutrition. So you find now that people have been displaced, they're not able to access food, a balanced diet. Maybe the actors there are only able to bring in the salt, biscuits, and some bit of meat. So maybe, fruit is going to be something that is not going to be seen for some time. And therefore, you're missing out on certain good nutrients. And therefore malnutrition is, takes up a very good chunk of the causes of death in emergencies. And then we have diarrhea at 19%. We have acute respiratory infections at 19%. We have perinatal at 18%, 5% going to malaria, measles, and 32% being others. Inadequate dietary intake leads to weight loss, lowered immunity, and mucosal changes. And this normally affects the incidence, duration, and severity of many diseases, particularly diarrhea. Okay, that is why we've put malnutrition in the middle, because of that lowered immunity, then you're susceptible to a lot of diseases, okay, that take advantage of that issue. And now as the disease spreads through the body, then of course it worsens the state of malnutrition and therefore causing death, okay? So communicable disease indicators have important interactions with indicators in other sectors, such as nutrition, okay? That is really what the image is showing on the screen. So when we're talking about water-related diseases, we have, for categories, we have waterborne, that is, drinking water that is not clean, that is not safe. And the possible diseases that could occur due to drinking water that is not safe include diarrhea, cholera, typhoid, and so on and so forth. So the only way to mitigate that is to ensure that the drinking water quality is of acceptable standards, international acceptable standards. And that means we need to remove or kill the pathogens that exist in this dirty water. Then we have water washed. These are pathogens, around the skin or eye area when you're touching. So it's transmitted through you touching something and then touching your skin or touching your eye that is contaminated. An example of that disease is trachoma. And this is quite prevalent, especially in the pastoralist communities. The only way to stop this is to ensure that there's enough water needed for basic hygiene, and also hygiene promotion needs to be done so that we can improve the hygiene practices in such communities. Then the third category is water-based. These are pathogens going through the skin, e.g. schistosomiasis. And here we encourage people to not bathe or swim in water that is known to be contaminated. Therefore, the only way to mitigate that is to ensure, again, that there's enough water for basic hygiene that has been provided for. And then we have the water insect vector, that is the fourth disease group or category. And here pathogens are passed on by insects that live or breed in water, for example, malaria, dengue fever, filariasis, and so on and so forth. Therefore, here we would get rid of stagnant water that encourages the breeding of such insects, and also using nets that are treated, or wearing long clothes to ensure that we've covered up a lot of the skin that could be prone to some of the bites, okay? So unless adequate water and sanitation services are quickly provided to emergency affected children and their families, it is almost assured that disease and death will follow. Okay, so that is why we are just looking at what diseases could come up. And this could just be, for example, you have moved people away from the disaster area, but because people are all cooped up, they are all crowded in a certain area, then you should be starting to prepare for these 4 categories as a humanitarian actor. Okay, so when you're talking about water, it's good to note that unsafe water kills 6,000 children every day. That is about 1 child every 15 seconds. And 1 billion people in the world lack basic water supply. And a person, you as a person, me as a person, can only go 3 days without drinking water. So lack of water supply denies a person dignity, energy, and time. And if I can even add to that, it can also deny someone their life. Okay, so that is why water is very, very important. And you can see that the statistics are quite worrying. So when we are now in a disaster or emergency phase, and this is the acute phase, the disaster has just happened, we have moved people, or the government has told people to move to a certain allocated area for them. So they're internally displaced, okay, or we have immigrants coming in. Then there's various ways that water supply can be achieved in those camps, through water bladders, hand dug wells, boreholes, installation of hand pumps, gravity system, rainwater harvesting, and water trackers. So water bladders, basically, as you can see on the image at the bottom where you're seeing some yellow sacks with green pipes, it's really just, those are water tanks that are made of rubber, PVC, or other synthetic materials that are normally foldable. So the technicians on site or us as humanitarian actors can easily unfold them and fill them with clean water and connect them to taps. Okay, so water tracking can support filling of these bladders, or piped supply to the bladder can also support filling of these water bladders. Then even the good thing about the water bladders is the contamination. There's not much that can happen, unlike a PVC tank, that has a wide opening at the top. And there you can find that a few rogue community members would rather just stick their 20-liter bucket inside, lift it up with water, and of course that now starts introducing some contaminants into the water. So disinfection of the water can also occur while the water is in the bladder itself. And there are various sizes of these water bladders, from 4,000 to 10,000 liters to 20,000 liters, although the 5,000 and the 10,000 liters are the most common variations, because it's easy for us as actors to move them to where they're needed. It's also important to mention that hand dug wells are holes made in the earth. People are able to dig and line them to make them strong and prevent the walls from collapsing. And from hand dug wells, you can access the water through a bucket and rope, for example, if this is an acute phase, so you don't have time to start building nice fancy protection around the well. The most important thing is that water can be extracted, it's taken somewhere, treated, and then distributed to everyone else. Electrical pumps and hand pumps can be installed on hand dug wells. And it's good to note that normally if there's a hand pump, it can support about 100 families, which is a good thing, especially where you're talking about over 1,000 people. Okay, so you can now try to figure out how many hand pumps should I install, where should I install them, to make sure that there's also not much crowding and waiting time at these water sources. Okay. Boreholes are, holes as well made in the earth. normally a very small diameter, about 4 to 6 inches, and they are much deeper than the hand dug wells because it's, you know, a truck coming in with the drilling component installed there. So it's able to drill deeper or dig deeper than the manual way, okay? And the depths of the boreholes are quite dependent on the groundwater aquifer. And you know, that just really says that if the water table is closer, then the depth of the borehole is going to be not that much. Or if the water table is really low, then you're going to drill a lot more, a lot deeper to access the water that is needed, okay? So that is just an overview. Of course, rainwater harvesting could be cheaper, could be faster during emergency response, but you know, it's also dependent on the area of emergency response. Where we have a situation or an area where they receive a lot of rainfall, then rainwater harvesting could be a quick fix to it. Where it's an arid area, then of course rainwater harvesting may not be an option because, you know, you never know when it's going to rain and the quantities may be very little for it to sustain any life. Now, when it comes to water tracking is quite popular because sometimes people assume it is a no-brainer. I mean, you have a truck, fuel it, put, you know, 5,000, 10,000 liters on it, have it moving. The issue with water tracking is the location of where the water is being taken to. You might find that as much as it might be a no-brainer, it might incur a lot more costs to have numerous trucks moving back and forth from camps, delivering water if the distances are quite long, as compared to you know, you exploring groundwater, for example, putting in a nice protected borehole might have you producing a lot more water, and in the long run, the costs might be much better or more bearable than going on with water tracking for a very long period of time. So there normally is some cost benefit analysis that has to be undertaken at the onset when you're providing the humanitarian response, and at some point where we say you have achieved stability, where you're not anticipating that the disaster might or the emergency might strike again, so people are now trying to get back to the normal life, then you weigh your options again. If it was water tracking that was the best option at the acute phase when the emergency had just hit, you might find that maybe people are not going to go back home to their homes quickly, and resettling them might take a year, 2 years. So water tracking might not be sustainable for 1, 2, 3 years. And it might be important for us to now explore other more permanent or more sustainable water supply systems. When it comes to water treatment, there are various ways this can be achieved. Chlorination, of course, is what is most popular. It's quick. The tablets are quite accessible in most parts of the world. Or it could be that the water trucks are already moving about with water that has come from a treated source. So it's really just tracking and then delivering to the tank. Chlorination can also occur at community water system points or collection points by putting in a chlorination booster or dozer at that point, so that you ensure that what is being fetched is for sure treated. Of course, there are other ways of treating at the household level, like boiling water or putting water in transparent plastic bottles and leaving them out under the sun the whole day, making sure that the UV rays are killing the pathogens that are in the water. So there are quite a number of water treatment options. Chlorine is normally the most easiest treatment option at an emergency context. Then when you're talking about sanitation and hygiene, it's quite important to note that 2.4 billion people, or 2/5 of the world's population, lack basic sanitation facilities. And the simple act of washing hands with soap and water can reduce diarrheal disease by 1/3. Okay, so hygiene-related illness costs developing countries about 5 billion working days per year. 5 billion working days per year. So you can see how much sanitation and hygiene is very, very important. And a case in point is the Haiti 2010 earthquake. After that earthquake hit, thousands of people were left without sanitation, often camping in tight, compacted, and concreted areas where no latrines could be dug. So a lot of actors came together and they tried to come up with a solution to ensure that people are able to access sanitation, or excreta or human waste is well disposed, hygienically disposed. And they came up with these people bags. These are biodegradable bags that were to be used as substitutes to the conventional toilets. So the used bags would then be collected and placed in a central waste bin and then buried, because then they're able to degrade. Okay, so sometimes certain situations do not allow us to install the conventional toilets, even the pit latrines that would come off as obvious, and therefore we need to adapt to the situation at hand. So the next slide is just showing you temporary latrines that have been constructed in a number of ways. The first one is just from local wood, cement, brick, timber, nails. Use of a toilet pan, could be a plastic one to just help with cleaning it quickly. And you can see the sheets. There's some plastic sheet that has been used to provide privacy. The second one is a portaloo. I think we have interacted with at some point. We've seen them at big functions. So portaloos are portable and they come ready-made. All we need to do is just dig a pit where now the fecal waste will be deposited. Okay, and we can see the third photo is ongoing of digging for pit latrines and putting up the substructure. Okay. Then when you're talking about planning hygiene promotion, a rapid assessment is quite important so that you are able to develop a promotion campaign that is relevant to the target audience. The rapid assessment will tell us, what age groups are there, how many there are, what their religious and cultural practices look like, and their general acceptance of the initiatives or implementation of emergency response that is being planned for. So the rapid assessment may consist of mapping the community to show the location of important features such as the water sources, the latrines and community facilities. And an exploratory work is quite important so that now you're also able to visualize alongside the community, and you have a better understanding or bearing of where these facilities are. So hygiene promotion that supports behaviors, community engagement and actions reduces the risk of disease, and that is really fundamental to a successful WASH response. When it comes to planning the promotion campaign, these are the main steps. Remember, you don't have a lot of time. The emergency has just happened. So you're coming together quickly to figure out what message you're passing on when it comes to hygiene promotion. So you need to set a goal. Of course, always overarching goal is to improve the quality of life or to reduce the loss of life. And then the next step is to identify hygiene problems. This could have been already identified in your initial assessment. That is a rapid assessment. And the third step is identify key behaviors linked to the problems. This could be related to activities such as hand washing or improper excreta disposal, but could equally be related to a poor understanding of the technology that has been introduced to mitigate the effects of poor WASH practices or just wrong attitudes to gender issues or the environment, okay? Once we've identified the key behaviors, then you can determine the cause of the problems, which will now will be tackled with a campaign that is set, and then prioritize action. So you need to decide which problems to target first, which ones are, more life-threatening, which ones need our attention more than the others. So this will depend on balancing priorities for improving health and the available resources. And then, of course, develop a strategy. You now develop the tools or the methods you intend to use to implement the promotion campaign. So this is just an image of a promotion campaign that was being planned alongside the community. It's normally quite important to ensure that you're involving the community at every step of formulating the promotion campaign, so that even the messages that you're trying to relay to the community are well understood and well accepted. So some of the tools that can be used include posters, theater, puppet shows and games, film and video presentations, focus group discussions, or sometimes just visits to people's dwellings. In summary, this is how hygiene promotion in emergencies is carried out. So there's the community and individual action, use and maintenance of facilities. There's a lot of monitoring that takes place, especially for humanitarian actors, to just assess whether the intervention is effective or we need to change strategy. Then community participation, as I mentioned earlier, it's very, very important to ensure that that is integrated in the formulation of the promotion campaign. Selection and distribution of hygiene items. Again, there's a lot of religious and cultural practices that will determine what is selected and distributed. And then, of course, stakeholders, because you're not working in a silo, so there has to be engagement of stakeholders. You won't be the only humanitarian actors, or there are normally quite a number of humanitarian actors that are working within the same area of emergency. So it's normally very important to make sure that these actors are well coordinated. And I think that was just a brief overview of some of the course content that we are offering as Humanitarian Global. We definitely go in depth in some of the courses on emergency response. So mine would be to just urge you to look through the WASH courses that are being offered by Humanitarian Global, and take as many courses as you need. And let's interact further at that point. But for now, allow me to just say thank you. Thank you for your attention, and I'd like to pass it back to Diana. Thank you very much.
Thank you so much, Susan, for that informative presentation. We'll go right into the question and answer bit of our webinar. And I do have a couple of questions here for Susan. However, if you'd like to ask your question live, kindly do raise your hand and we'll allow you to speak and ask your question. So my first question here comes from Hassan, who says, how can we control the quality of WASH service that we provide during the emergency cases?
Sorry, come again, how can we?
How can we control the quality of WASH services we provide during the emergency cases?
Thank you very much. Quality would mean that there's a lot of monitoring that is done. It's normally very easy for us to just go in, put in taps at certain points that we feel are most ideal, put in whatever sanitation structures that we feel are quick, are easy to put in. But then there has to be monitoring that takes place. So once you've put in a water bladder, for example, and you've installed taps at the end, you'd want to station a staff member at the taps, and the staff member would be tasked to look at the collection times. How many people are queuing? Are the taps enough? Can we add more if they're not enough? Or if they're okay, then what we are monitoring is that the water flow is, there's constant supply in the bladder. There's no time where the bladder is completely empty. We are monitoring the infrastructure that we've put in. Is it sustainable? Is a tap broken? Is the door to a pit latrine, almost falling off? Then we need to ensure that it's quickly fixed. Basically, it's just about monitoring.
Thank you, Susan, for that. Again, Hassan did follow up from that question and ask, how can we manage the sludge?
All right. This is dependent on the type of technology you use. For example, if it's a pit latrine, then you might find that management or operation and maintenance includes putting in lime or ash in the pit to reduce the smell or the odor. And once it's filled up, then you just make sure it's fully covered. We have instances where even a tree can be planted where a pit latrine was, so that the nutrients from the fecal sludge, feed the tree and it's able to grow. If it's an open field that has been, set out for defecation, then of course that is another technology that requires you, or it's not even just technology, it's just an open field. So it means you've put it in a place where contamination will not occur to ground or surface water, and there is spread of ash and lime to treat the sludge. If it's just a pit that is shallow, then of course you're putting in a bit of lime, mixing it up, making sure that you've completely killed the pathogens and then covering it up. So the sludge management is highly dependent on the technology that is used. Okay.
Thank you so much, Susan, for that. And we'll go on to Kayumba's question. Kayumba says, in any event of floods or landslides, sectors which are likely to be affected are humanitarian settlement and shelter, health and nutrition, water and sanitation, education, agriculture and food, infrastructure, and cross-cutting issues. Actually, this is not a question, but this is more of a comment. I believe, Susan, you agree with that. Maybe you'd have something to add on to that comment.
Yes, I agree with Kayumba. There's, when an emergency or a disaster strikes, most often than not, it's intersectoral or multisectoral. So humanitarian actors will come from all sectors, okay? They'll come from, people who would typically deal with nutrition, people who typically just deal with water, sanitation, hygiene, education, UNICEF, for example, because of course, children would be part of those that have to be resettled, and education has to still go on, or as much as it's not the normal, going to class or such and such, but education will still need to go on. So multisectoral interventions normally occur or are normally happening to mitigate the effects of an emergency. So I agree. Thank you.
Thank you so much, Susan. And someone does ask, how do we ensure that the services we provide bring changes in the beneficiaries' lives?
The services that we provide in the humanitarian or the emergency response definitely, of course, are going to change their lives. Now, what we should be thinking about is, are we changing their lives for the better or for the worse? Okay. For the better could, again, bring us back to the monitoring aspect and even the hygiene promotion, campaign strategy formulation, where you're looking at what this, the religious practices that are prevalent in that group, the cultural practices that determine what they take up and what they don't. For example, even just the positioning of the toilet, you find that there are other religions that require that the men's toilet is on the right and the women's on the left. So it's a matter of trying to just get as much information as possible in the littlest time possible to ensure that what we are putting in from the onset is effective, is mitigating the loss of life. And then thereafter, we begin monitoring, or rather we start monitoring from the onset, okay? So as we continue with mitigating the emergency issues, then you're monitoring to see whether you need to change strategy, whether it is acceptable to the group, or we need to, you know, introduce something else that is way more acceptable to what we had already put in. So it's a lot of monitoring, a lot of, you know, observation, and also awareness, because you'll find that a lot of the humanitarian actors have already had presence in that country. So they already have some bit of bearing or understanding on what works best and what doesn't work best. And so they can borrow heavily on what has already been done previously, right? Thank you.
Thank you so much. And I see a couple of hands are up. So I will request Ahmed, Bali, Mohammed, Ibrahim, prepare yourselves with your questions. In the meantime, I'll take a few more questions from the Q&A section. This one is from James, and James' question actually combines something from other participants, including Ibrahim. I do see a Behe. So James does ask, how do we handle wash concerns in flood-prone areas? This is in terms of contamination of water and diseases, as well as this one, I'll just combine with the next question from Ibrahim, who says, is there any formulation that uses for water chlorination? As well as this question does cover also the villages, the communities, how the poor are affected when it comes to practices in emergency situations. So the question itself is, how do we handle wash concerns in flood-prone areas?
Thank you very much for the questions. How do we handle such? It's quite tricky because you find that these people living in these flood-prone areas are looking for places where they can, you know, farm and are assured of, you know, water supply. However, there are so many structures that we can put in to stabilize the area and reduce the instances of flooding. For example, installing flood control structures such as dams or weirs across rivers that, you know, slow down the flow of water through certain water bodies. There's a use of gabions if maybe the soil in the area is quite loose, so that you're also trying to stabilize the soil. So it's quite a number of varied approaches that can be used depending on what is encouraging, you know, the flooding in the area. If it's a flat area and it's a drainage area, then maybe you want to either divert the water body into another part because it's flat, you're able to do that, or you also want to resettle people permanently to areas higher than the flood plains. So there's quite a lot of approaches that can be used that are also determined by the resources that are available to us. And the second question, Diana, if you can come again, please.
The question was, I just combined them because they sort of speak on the same thing. So something else was, how do we prevent the slide back of villages, communities, in ODF situations? And something that also does touch on the flooding is there any formulation that uses for water chlorination? So this is in the treatment of the water.
Okay, so I think I've answered the second question as well, because the approaches can be quite varied. The other question on treatment is really formula that one would use to treat water through chlorine. So the safe levels of chlorine in drinking water are between 2 to 4 milligrams per liter. Okay, that is what is required, WHO guidelines in water treatment. And of course, there's the residual chlorine that occurs as water is moving through pipes or after fetching and it's put in a jerry can. The residual chlorine will continue to treat the water. So if you're asking, maybe if you have 1,000 liters, how much chlorine do I need for it? remember, if you're saying that you need 1 milligram per liter of chlorine, okay, or 2 milligrams per liter, then you're just it's simple maths basically. If it's 1 milligram of chlorine per 1 liter of water, then you need about 4 to 5 of chlorine, 4 to 5 milligrams of chlorine to treat 1,000 liters. So it's just a simple mathematics that one can do. I hope that answers your question.
Thank you so much, Susan. And actually, your answer also touches on Mohammed's question as well as Hak's question. So now we'll go to the live bit. Our participants who've raised their hands. So Adane, you can unmute yourself and ask your question, and you'll be followed by Ponya and then Muhammad.
Okay, thank you so much. I asked a question here. I put it as a message, but I could just read it out. Thank you for the presentation. In an emergency watch intervention that I came across, a bowel that requires rehabilitation. The bowel has not been working for 2 years because a dead body was buried around the bowel by drunken men who were drunk. And then it is just around 10 meters away from the bowel. In our assessment that we carried out, we found out that the community are really suffering, and they are asking that the bowels can be rehabilitated because it was closed by the county watch department. In your suggestion, do you think such a bowel in an emergency situation can be rehabilitated, or what can you possibly suggest? Thank you.
Thank you, Rod. Just maybe if I can seek for clarification, you're saying that a dead body was buried, was it inside a borehole?
Yeah, just closer to the borehole. You know,
close to the borehole.
Yeah, the pond where the water, the dirty water goes. So they found out that it is the softest area that can be easily dug, and then they buried the person around there. So my question is, the community are asking that the borehole has to be rehabilitated.
Okay.
This is a live scenario. So do you think it can be rehabilitated, or what are your suggestions? Thank you.
Thank you. The first step would be to determine, first of all, the position where the body was buried, and to see if it is upstream or downstream of the borehole. If it's downstream of that borehole, it's unlikely that the remains would contaminate the water. However, it is quite important for us to do water quality testing. Just because it's coming from the ground doesn't mean it is clean. So water quality testing has to be done. And once the water has been deemed safe, I'm assuming that maybe there's not much contamination, or it is just issues like minimal traces of fluorine or iron that can be treated. This could also move into maybe religious or cultural practices where they're not comfortable, maybe because dead bodies are a taboo. They shouldn't be anywhere near places where we congregate, or we are fetching water for sustenance. It could be important to bring in the Ministry of Health to ensure that maybe the body or the remains are well, they're transported to another burial area. And then a surety. You see, now hygiene promotion would come in, because then now you start assuring the community that if this borehole has worked well and it's water, then the water is okay. The tests suggest that only this treatment needs to be done for the water to be safe. If it is not that case, then maybe establishment of another borehole upstream, further upstream, could be something that is also suggested. So there needs to be a bit of assessment that is done. And unfortunately, from where I sit, I might not tell you absolutely that this is the way forward. But if you do follow those parameters, as well as reassuring the community in the area, if the water is safe, that they should be able to draw the water, then that should be a situation or a possible paths that you can take up. I hope that answers your question, Ruth.
Thank you so much, Susan and Ruot, for that. At this time, I'd like to welcome Justin. Justin, you can ask our final question because I see we've gone beyond time. Justin.
Diana, thank you so much, and Susan for the presentation. I just need to, Susan, to maybe repeat one of the questions that was asked, and I didn't get the answer well. It's about the quantity of the chlorine that is used with a certain quality of the water. It was talking about something in 1,000 liters. I didn't get that well. Thank you.
Thank you, Justin. Just to repeat that, the chlorine levels for water to be regarded as safe should vary between 2 to 4 milligrams per liter. That's about 2 to 4 parts per million ppm. So it should be 2 to 4 milligrams per liter. Justin?
Thank you. Yes, okay. I got Susan. Thank you.
Welcome.
Thank you so much, Justin and Susan, Ruot, and everyone else who's asked questions, including in the chat section, the Q&A section. There's actually quite a number of questions that have been asked here, but in the interest of time, we're not able to answer all of them. So what we will do is we do have a community forum. We're going to answer those questions on the community forum for you. So I do encourage you to join our community forum. We are sharing the link on the community for the community forum on the chat section. So kindly do check your chats. We have shared a link for joining the community forum, and that is where we're going to be answering a lot more of these questions. At this time, I'd like to say thank you so much to all our participants who've been able to engage with us. For those of us who were even able to ask so many questions, for those of us who were able to let us know even where they're joining us from, their interest in taking up the courses, the 2 courses that I did mention. This is proposal and report writing, as well as humanitarian essentials and principles. So the 2 courses, we already do have a number of participants who've shown interest. So thank you so much for that. Thank you for everyone who joined this session, everyone who was able not just to interact, but also to follow through. We will also be sharing the recording and the presentation that Susan did make on our community forum as well, and on YouTube as well. So we will share the link to join the community forum where you'll access all these resources. I'd like to say thank you to our expert, our WASH expert, Susan. Thank you so much for such an informative presentation. I believe we've all left this webinar knowing a little more than we did when we joined it in the beginning. So thank you so much, Susan. Finally, I'd like to thank the Humanitarian Global team for having facilitated this session, for having made this webinar possible. So thank you so much. Even the webinar is usually live streamed on Facebook. So thank you, Humanitarian Global, for enabling this. As usual, we have webinars every Wednesday between 11 and 12 p.m. This is the time in Nairobi, East African time. This is 11 a.m. to 12 p.m. every Wednesday. So I guess I will be seeing you next Wednesday for our next webinar. Goodbye.
Are you a humanitarian or development professional looking to take your skills to the next level? Then our self-paced online courses are perfect for you. We cover all the key areas you need to know, including monitoring, evaluation, accountability, and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition and emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant and young child nutrition. Our courses are designed to help you advance your career, stay ahead of the competition, and make a real impact in your field. And the best part is that you can study at your own pace and on your own time. So don't wait. Enroll now and start advancing your skills today.